So talking about support for people with children of those affected with dementia, what gaps do you think are missing still? Where do we need to see
Um,
some change?
so
Have you
many
got a
gaps.
list?
I have a lot of projects going on at Dementia UK, and I think there's so many gaps. There's so much that we can do. Resources to educate, support children across the country, opening up peer support I can't speak, peer support programs. So our research project with Bangor University, we're looking at peer support program for young dementia carers, and we hope to embed that once the research is finished. So that's a big gap. Children want to meet other children in similar situations, and that can be powerful because a lot of children don't necessarily need my support. They actually just need to meet another child going through the same thing, and that's a big gap in support for young dementia carers as well. So there's so much we can do, and I think being that ambassador side of my role as well, raising awareness with our media teams, talking to the press, working with Coronation Street, we're working with the producers and the script writers to ensure that we reflect truly what young onset dementia is like across the family as well, and that will help people think about the children and think of in services, even within admiral nursing. 484 admiral nurses across the country, I support them, and it's often about, we know they do have sometimes have strict referral criteria because of what we work with complexity, but it's actually looking at opportunities to support children across the UK, and working with young carer organisations within the services as well. And a collaboration we know can't do it on our own. It is a real collaboration across many different organisations, charities, health and social care as well, education too.
I think just touching on the Coronation Street thing there, that is one big hit, isn't it, of raising awareness of how that can affect the whole family, because so many people will watch that, and you've done such a brilliant job working with the producers and the script writers there to get that right and to get that point across. I think that's been really important. So well done there, and well done to them as well.
Yeah, it's been amazing working. It's been a team of us in Dementia UK and using that experience, and that's what we want to get across as well. And it gives me goosebumps actually watching it and seeing some of the actual scenes, thinking, it's getting that message across. And for our families that we support, and every time we look at a script, we're thinking about the realities of what it's like, and it's good to hear that it's coming across that way as well. That people are learning and understanding more.
Yeah. So, given all those different gaps, if you had a magic wand, what would be the priority? I'm going to put you on the spot there.
On the spot there. My priority.
What's really pulling at you?
I think it's like local support. I think we need children. We need children to be recognised within the families. I think we need children when we know children aren't there when the person is diagnosed, and they're not there in the hospital or the clinic. And I think it's about that link of when someone receives a diagnosis, it is actually, people think about the whole generation, intergenerational impact, and that just thought and process will enable a diagnosis within the family to really identify the needs of each person within that family as well. And I think that is what I would love, is when a person has that diagnosis, that it is a family approach to a diagnosis. And ongoing as well. I know in dementia care and diagnosis, you get diagnosis and that's it. See you when you have a crisis. We'll see you. Not at all sometimes. And I think that's really important, that we need that ongoing support and recognising dementia as a palliative condition and embedding support for the families, lifelong support as well. And also, I think recognising dementia, sadly, when the person living with dementia does die, that doesn't mean it doesn't stop continuing impacting children's lives, because there's a huge amount of loss and grief from especially young onset families not having that parent in the future as well. So that would be my plan, to have that continued support for children and families.